Oh, hello guys, it's Duncan here from Go Physio, and just put this presentation together for yourselves to sort of chat through some running injury prevention bits and pieces. So hopefully you will find this informative and helpful for yourselves. And obviously, if you have any questions or anything you'd like to sort of go through or anything like that, sort of put those together and get them over to us, and then be happy to chat through those bits and pieces with you. So with regards to running injury prevention, there's a lot of beliefs that people kind of have, and a lot of the beliefs that people do have, and from sort of a runner's point of view, is that they kind of got split into two main areas, one being extrinsic factors and one being intrinsic factors. Now, the main extrinsic factors that runners felt affected or believed sort of causing their injuries were not stretching, not warming up, excess training, lack of strength, and wearing the wrong shoes. Now, of these extrinsic factors, starting off with the not stretching side of things, they've been found through research that stretching doesn't really play a big factor in kind of mitigating or reducing injury risk in a sort of significant manner. So doing static stretching as part of a sort of injury management plan, or kind of like a injury reduction plan, is not something that's really going to be providing a great amount of value for yourself. So just doing that is not going to be sort of changing at all kind of your chances of potentially picking up an injury. Secondly to that, talking about kind of shoes, and this is quite a big subject within the running world, and there's lots of different running shops that will tell you, right, you need a certain type of shoe for this and a certain type of shoe for that. But the big one that does come up a lot is to do with pronation. Now, pronation as a movement is quite an important factor in our gait cycle, so how the leg is moving when we are walking, when we are running. And it's something that needs to happen. So if we're purchasing shoes that are anti-pronation shoes or pronation reduction shoes, whatever the sort of selling tag that these sort of manufacturers and shops have put on them, that isn't preventing or reducing your risk of an injury, because pronation is quite a normal thing to happen in the human body. So that's something that is always chatted about with a lot of runners, and it's something that we don't need to be too concerned with. It's something that just happens and is part of the sort of running cycle. And then also with sort of shoes, they found that wearing kind of different types of shoes for training actually didn't maybe make much difference either in terms of kind of sort of helping to kind of either reduce injury risk or increasing injury risk, and that, you know, shoes should just be worn in terms of kind of their comfort. And that's the sort of main factor that we should be considering when we're running. Are they comfortable to wear or not? And not kind of over worrying about pronation or I'm wearing the wrong type of shoe for what I'm trying to do. The other side of things are sort of intrinsic factors. So not respecting the body's limitations and the foot type changes. So that's, again, that pronation side of things with the foot type changes. It's not something we need to be worrying about. It's a very normal thing that we will have within our running movement and walking movement. So it's not anything we need to be overly concerned about. And in terms of not respecting the body's limitations, that generally factors into what we're going to come on to in a moment, which is all to do with kind of training and listening to our bodies when we're training and sort of respecting what's going on with that. But again, sometimes people don't listen to what their body's telling them, and it can have a much more significant impact than people may think. So the real reasons that we sort of tend to see an injury is mainly through training load error, physical well-being issues, psychosocial well-being issues, and any kind of environment changes. Now, the latter two there, psychosocial well-being and environment, have definitely been a much greater factor more recently within the last kind of 18 months to 2 years, particularly due to COVID. So these are other factors that may have been something that people may have not considered prior to you potentially watching this presentation today. So training load error is been estimated to be about 60 to 80% of the cause of injuries in runners. Now, training load error can come in sort of many different ways. So what we look at overall is kind of the training load. So training load is the product of external and internal loads. Now, what's an external load and what's an internal load? So external loads are the applied mechanical load going through the body. So your training volume, your training duration, your training intensity, how that is loading the body. And then our internal loads are our physiological and psychological responses to external loads. So from a physiological point of view, that would be our rate of exertion, how hard we feel we're working, and blood lactate levels. And psychologically, again, how hard do we feel we're working? Are we fatigued? Are we sort of tired from what we're doing? So these are the two main areas that we kind of need to be thinking about from a training load point of view. And are we appropriately managing those external side of things and those internal side of things? Now, starting off, we want to sort of look at training volume and duration. So what we found sort of looking through the research is that there was an increased risk if we were doing less than 2 hours a week. So if we're doing less than 2 hours of running training a week, there was a higher risk of an injury occurring. And the sort of relative threshold of kind of having an injury becomes greater with higher weekly mileage. So if we're training for like a marathon or an ultra marathon, we're obviously doing a higher volume of running. So there is always a slightly greater chance of something happening within that because we have a higher external load. You know, we are applying more mechanical loads to the body because we are doing a greater volume of training. So as we are training for these longer races, there is always that chance that you might pick something up just because of doing more. That's quite simple with that one. And the other big one is kind of mileage. Now, we've potentially all heard of this kind of magic 10% rule that majority of people will kind of follow if we're building our mileage up for training purposes. So training towards a 10K or a half marathon or a marathon or an ultra marathon, and taking a 10% of that previous week's mileage and then adding it on to the next week to kind of build things up. Now, this 10% number is not really a proven number that's, you know, a good thing or a bad thing. It's just kind of been put together over the years and just sort of kind of been stuck with by a lot of people. But in terms of the research, it's kind of showing us that really we can have quite a vast percentage change depending on the individual. You know, there's been some people that can increase their mileage by up to 30% per week, but it's all down to you as an individual and how you feel within yourself. So we can use that 10%, but it's not a magic number. It's not a definitive thing. It just has been kind of put upon as this is kind of the thing that, you know, roughly seems to be okay for the majority of individuals in building up their mileage. Now, next we were sort of looking at training intensity. So this is kind of how hard we're working, sort of how much exertion are we putting in. And overall, there wasn't too much of a kind of significant relationship between doing a higher exerted session versus a lower exerted session in terms of potentially causing a training load error. So intensity didn't seem to affect things too much. Next, we sort of looked at training frequency. Now, they sort of showed that there was a potentially increased risk if we did less than 2 sessions a week, so only once a week, and if we did greater than 5 sessions a week, so 6 plus. But within this sort of 2 to 5 number, there hasn't really been an optimum number of sessions that's been identified. So there's not, again, a magic number of like, well, we must go 3 or 4 times a week. Again, it's more down to kind of individually how you feel you're getting on, and if we feel that this is what feels right for you in your body in terms of what we're doing. So this is more of looking at within yourself how you're feeling and trusting that, okay, if I do 2 sessions, we're going to be okay, and 5, we're going to be okay. It's just more down to within yourself what feels correct and how your body feels with what you're doing. The other thing that we looked at was training type. So obviously within our running training, we're going to have a variety of different sessions, and big ones that are a higher external load is doing some hill running or sprint or interval sessions. And these apply a different demand on the body than running on the flat at a continuous pace. These are a slightly different change in sort of what's going on. So these are always something we have to kind of consider when we're doing these training sessions, and we have to kind of look at, are we giving ourselves kind of sufficient rest and recovery to incorporate these different external demands on the body. And again, they will then affect obviously then an internal load as well. So, you know, if we're doing hill running or sprints or intervals, it's probably going to be a higher level of blood lactate because we're working in a more anaerobic window than an aerobic window. So how is that then affecting the muscles and their ability to sort of do the job we would like them to do when we're running? So overall, with training load error, there's not really a magic formula or anything like that, but what we can do is just use some nice simple guidelines to help mitigate training load error from occurring. So gradually increasing that mileage. Now again, like I mentioned, it's not like we have to do 10% or 20% or 30%. It's more about what you feel within yourself has maybe historically worked well for you or feels good for yourself. So going with what your body feels good. Looking at intensity in terms of changing those things just in isolation, so not trying to go faster and longer at the same time, just changing one or two things, and that's going to then affect our kind of rate of perceived exertion, so how hard it feels to us. So generally, if we change more than one thing at once and something does occur in terms of an injury, it's going to be very hard to identify whether it's the going the faster or going the longer that has changed that scenario and caused an injury to happen. So if we're going to change anything, we just want to change it in isolation and not change multiple things at the same time. It's very, very good to have an awareness of your body. So kind of listen to what your body's telling you and kind of almost preempt potentially something happening. And sort of if we're getting little niggles and aches and pains here and there that may be there for a day and they've kind of gone, but they keep kind of cropping up, it's potentially something going on there, and it's just to have an awareness of these things happening and addressing those, sooner rather than later. So that last point there, getting that help there sooner rather than later. It's better to come and get some help and only maybe need a couple of sort of sessions to sort of help out with that versus keep pushing, and then we then need even longer to sort of get ourselves back up to where we want to be. And utilizing our rest effectively. So rest doesn't have to mean just totally doing nothing. We can do a bit of cross training, so doing like some cycling or some swimming, and you're doing something that's taking our weight off of our feet and doing an alternative. It's not a total rest, it's what we would call like a selective rest. So we're doing something alternatively to help manage our external loads to affect that training load component. Another side of things with looking at kind of training load is our physical well-being. So the two kind of key factors that will affect the training load is our BMI and history of a previous injury. So BMI as kind of like a singular factor is something to kind of take with a little pinch of salt, but they have identified that if we have a BMI greater than 25, we are potentially affecting our load going through our body that's going to then affect that training load. So making sure we're keeping ourselves at a healthy weight and keeping ourselves there regularly and not fluctuating too much. So that's one thing we have to consider. And then any previous injuries that we may have had. So if we've had any injury within the last 12 months, there is a potential increased risk of a reoccurrence of a similar injury or having another injury that will occur. So if we have had any injuries, we just need to be very conscientious for the following 12 months. The pain and everything might resolve and we might be back to training, well within that 12-month window, but we just have to always consider things for a full year to make sure that we don't over egg it too early and then potentially have a reoccurrence of injury again. Now, what can be done to help counterbalance the sort of injury side of things is doing regular strength training and regular conditioning training. So with regards to strength training, that's usually looking at working at a high percentage of effort relative to body weight. So looking at working around 80 to 95% of body weight load, and doing that on a regular basis, kind of a couple of times a week. And then any conditioning training on top of that. So any hypertrophy work. So when we're working at about 60 to 80% of our sort of body weight, and our sort of endurance, where we're working around 40 to 60%. So adding these in as tools to help our training, support our running training, will help to particularly manage any sort of mitigation if we have had injuries within the last 12 months. And it just additionally will help your running performance and improve things in terms of speed and your time, and getting things kind of back to a good level. Now, a big thing on top of kind of the previous two factors from a physical point of view, we have more recently, as I mentioned at the beginning, particularly to do with COVID-19, is kind of our psychosocial well-being. And big thing that will affect this is stress. Now, stress can come in many forms and in many different scenarios, but main things that will kind of affect our stress levels is going to be things to do with work, things going on within our home lives, and if we've maybe got a running competition coming up. So what is important is that we are managing these stress factors, because they are going to affect our performance. They're going to affect physically how we feel. And if we're feeling physically different from kind of how we normally do, because we have a heightened level of stress through some of these factors, that's going to affect physically how we perform. And then if we are not performing as well as we would like to, and we're trying to push ourselves to keep going at the level we normally would, there is again that then inherent risk that because we're trying to keep pushing ourselves, that load, that external load, which is being affected by the internal load as well, of that stress, that psychological side of things, that risk of being fatigued and stuff just puts the tissues in a position, our muscle tissue, our tendon tissue, of not being able to perform as we want to. So managing the stress is an incredibly important factor. And this has kind of even been heightened a little bit more with COVID-19, kind of the concerns of maybe picking up COVID-19 and being ill with it, and with it being a respiratory illness, obviously that might affect things as well. But the side effect of the COVID-19 has been the lockdowns. And now within the lockdowns, lots of people ended up working from home. And then within working from home, we've then had increased time within our families. Now, everybody's families are different, but if we have people who have got kids of like school age, and they've been having to try and do like their job from home and helping their kids out with like schooling and stuff when we were in the lockdowns, that's going to have a huge impact on our stress. And if we're then feeling stressed, we might use our running as kind of like a stress management tool. But if we are then pushing ourselves, it's going to potentially end up in us having then a physical injury. So with COVID-19 and that working from home and the homeschooling and all of that side of things, earlier this year and last year, that's going to be affecting how we feel. Things are starting to kind of go back to a bit of normality now, but absolutely it's affecting everybody in a different way. And then kind of on top of that, from the sort of a social side of things, is with COVID-19, we had sort of sports clubs and everything had been sort of stopped. So where a lot of you guys are obviously a member of Eastleigh Running Club, there's a huge social component to that, going out and doing your group training and your runs, and not having had that for a good chunk of last year and maybe part of this year as well. That will have an effect on people, because people like to have that social side of things. Humans generally are social animals. So if we're not having that social side of things because of the lockdowns, that's going to have an impact on people's training. So we maybe had reduction in training potentially. And then when things have picked back up, people have then tried to go too quickly back into things. And because of that psychosocial component where we've then kind of limited ourselves, it then affects us physically because we will have lost some of our fitness. So COVID-19 has really had a big impact on things from this side of things over the last 18 months, more so than it probably normally has. So it's really something to consider, and even moving forwards, because, you know, maybe something like this might happen again in the future, and it's just really considering and thinking about, right, actually this is quite an important factor to consider and actually respect it just as much as the physical side of things. And then lastly, our training environment. And again, this has largely been due to COVID-19, where there was limitations again to gym access and running track access. And if, say, we used the gym for doing like interval training on the treadmill and stuff like that, and we didn't have access to that, and we're not familiar with doing that type of training outside of that environment, we're then again maybe not going to be doing that type of training, and then we're losing that benefit from that training type. And same with doing it on running tracks, because I know a lot of you will do a track session regularly where you will do your interval run on the track. So this is all starting to kind of normalize again now, but as I said, if something like this did happen again, these are things that we have to kind of consider and think, right, well, actually, normally, let's maybe actually add in a little bit more variety with our training. So let's maybe do more interval stuff that's maybe not in the gym or on the running track, or sprints or something, you know, along that sort of line, and doing it more out in the open. So on in like a park, or you know, that type of scenario where we're doing things more outdoors. But then what's kind of happened as well is that there's obviously been a huge influx of people picking up running and doing more walking outdoors, which obviously kind of affects the availability of space to a degree. So we have got to nicely kind of balance these things, but it's definitely good to consider working and training in different environments normally, and not just be reliant on kind of the one place to always be accessible to do that, because we may not have access to it. And COVID-19 really proved that to us, where we lost access to these environments. So overall, to sort of summarize through everything, we've got kind of these four main areas, with the latter two kind of affecting things more due to COVID-19. And it's just something for you to all consider and kind of have a look at, and look within yourselves at whether we are effectively managing our training load properly, and looking at the external and internal components of that. Looking at our training, within our training, kind of our duration, our frequency, our training type, training intensity, and looking at, are we all managing these as effectively as we can? And then from a sort of psychosocial side of things, you know, are we managing our stress? Are we effectively keeping on top of that and mitigating anything happening on that side of things? And then again, from kind of a training environment, are we actually, you know, giving ourselves the opportunity to be flexible in our training type, so that if we then do lose access to one training environment, it then doesn't affect us in our ability to train. Here is all of the references that I have put in the presentation today. So if you want to pause the video now and sort of go off and have a bit of a read of these yourself if you're interested in any of it. But yeah, they're all a great read, and really, really helpful information for sort of putting this presentation together for you guys. So I hope you enjoyed it. And again, yeah, if you have any questions or anything, or that you'd like to sort of go through with any of it in a bit more detail, then, you know, don't hesitate, get in contact with us, and I'm very happy to sort of chat through that with all of you. So thanks very much for your time, and thank you for watching, and have a good one.